And it also gives me a transcription so that I can email a summary out to everybody. We'll give everyone another few minutes to log on. We have absolutely no idea how many people are joining. So if it was just one person, we would have done this for one person. Might just be all of us right now, but we'll see. Give them another couple minutes. Jessica's on. Hello. Jessica, I told everyone we'd be giving them another few minutes to log on. There are always some stragglers.
Okay. Sorry, I was on another call, and Jen, I know Jen will join us here momentarily. But hi, I'm Jessica.
Jessica is our CFO for those who have not met her. Jessica, I am recording this meeting. I am just letting everyone
Okay.
know that it's being recorded.
Okay,
So don't say
perfect.
anything bad.
Melinda, it's nice to put a face with your name.
Well, thank you. You too. It's like, oh, okay.
Yeah.
Hello, Kelly and Kathy.
Hey there.
Giving everyone a couple minutes. We'll start at 12:01 since we've got more people on now. But we'll give everyone another. Oh, it's 12:01 now. I guess I said that and it changed. Anyway, we'll get started. We don't want anybody's day to be prolonged by this. We hope this is useful. But I'm Marta Andelson. I'm medical director for St. Francis Outreach and working with Always and Forever. Jen asked us as a medical team to put this together to talk through some of the exciting, we think, programs that we are putting in place and to also give anyone a chance to ask any other questions. We want this is a fairly open forum. I have a very short agenda, but after that, open for questions. I know some of the things that we'll be talking about may not be totally familiar or comfortable, so that is what we're here to do. First off, I would like everyone on the medical team who is on this call to introduce themselves so that when you guys are communicating with these people, you know who they actually are. Andrew, would you like to go first?
Yep. I am Andy. I am the VRC lead, so I will be doing all of the scheduling for our medical team. And right now I'm working closely with Teresa, just figuring out the cats. And then eventually, yeah, she's my partner in crime, who, by the way, is leaving me. But and then eventually I will be working into the dogs as well. So it's nice to meet everybody and see all the new faces.
Awesome. We'll just go around the room, jump in. Anybody else?
I'm Reagan. I'm RVT on the medical team, and I found out this morning that I am in charge of managing the volunteer program that we are starting up. So I'm super excited to kick that off and get that going.
Thank you, Reagan.
I'm Dina. I'm one of the techs as well.
And Julie is on the call. You all probably already know Julie or know of her. Hello, Julie.
Hello there. So I am currently in the car driving down to Oz. So I don't have my camera on, but I am listening.
Perfect. Thank you, Julie. Okay, we are missing Dr. Erica Stafford. She is on PTO, so hopefully if you have not met her yet, you will get to meet her at some point, but she can't join us today because she's on PTO. First task agenda item today is to talk to you guys more about VITA. This is the after hours emergency texting service that we piloted for the cat folks. I don't know if the cat people on this call knew it was being piloted with you, but we wanted to try this out. This is a way for anybody who has a foster animal in their care to be able to communicate directly with a veterinarian. They say within 90 seconds. I hope that's been everyone's experience so far, but this doesn't replace the veterinarians when we are during working hours. So if there are any emergencies during the day, that is Monday through Friday, please do reach out to a coordinator, foster coordinator, who will then escalate concerns to us. But after hours, what we are defining as 5:30 p.m. to 7 a.m., and on the weekends, if you believe that your animal is having an emergency, then step one will be to reach out to VITA. You do have to sign up for this. If anybody needs the instruction sheet for how to get signed up for this, please just drop it in the chat. I will also email it to anybody and I will send it in the chat. But there is one little hurdle. You do need to sign up as a foster with the organization and then you register your pet. I haven't done it personally. If anyone on here has experience using VITA, please let me know how much of a pain it is to register, but I think it's fairly quick. So after that, what do? You're registered your pet, then you click on chat and it will connect you with a veterinarian. These are not necessarily veterinarians in the United States. They're all veterinarians who speak English, but the way they're able to staff this is that in Australia, it's probably during the day when it's really late at night for us. So you might be chatting with an Australian vet, you might be chatting with a vet in the UK, but we're all generally trained the same, so we would all have generally the same recommendations. So they're going to ask you for information about the pet. You just get them as much information as you can give. Generally, they do ask for a video in the chat too. That just helps the veterinarian actually see the animal. There are some things that we know to look for that are pretty subtle in videos that will tell us, yes, this is an emergency, or no, this can wait. I don't think any of I think we've had 3 or 4 chats so far with our cat fosters through this service. I don't think any of the cats have been sent to the ER, but I do think that they've given some pretty good advice in terms of what might be causing the symptoms and when you should reach out to the vet team. Generally, they say reach out to your veterinarian the next day. If it's on a weekend, they might say on Monday, but they will give you a sense of how urgent is this. If they say to go to the emergency hospital, we generally work with Blue Pearl in Overland Park. If you are really, really far away from that hospital, then we can figure out a contingency plan, but we work really well with them. We get a discount with Blue Pearl. So that is our preferred emergency hospital. Melinda, you're in Wichita. We generally work with Besh. The one thing I will say about any emergency hospital is that they aren't always fully staffed with doctors. So Vesh has limited hours. They don't always have a doctor on staff. So there might be a little bit of a hiccup if you call and say, hey, I was instructed to bring this animal for Always and Forever by their after hours chat service. Do you have a doctor? And they might say, oh, we don't have a doctor. So I will make sure to work through these contingency plan steps for if that were to happen. And then we will just go from there. We are working on submitting a memorandum of understanding for any of the emergency hospitals we work with. Basically, that tells them this is what Always and Forever will automatically approve in terms of stabilizing this patient. This is what we need you to call us for. You don't need to worry about who will get called and when they will get called. You can just worry about taking them to the ER. You should not be getting asked for approval for anything on any emergency visit, because that should be pretty clearly lined out for the emergency hospitals in that MOU. If you are getting asked for permission to approve any treatments, then we just ask that you reach out to a representative within Always and Forever. And that I will not give you a name right now because I don't know the name right now. We need to identify exactly who that person is going to be. But I understand that there might be situations where maybe the ER doesn't know that we have an MOU, that receptionist doesn't work for a while. But we're trying to make this as easy as possible. Why are we doing this? We're doing this for 2 reasons. One, we want you to get as immediate an answer as possible from a veterinarian. Time is really, really important when it comes to emergencies, and the process of playing phone tag with Always and Forever might mean that there's a little bit of a delay. But second, very important thing for us is that we need to make sure that we are not burning out our medical staff. They are working really hard. We're all working a lot. And so the reason part 2 of doing this is so that we don't need to worry about, oh, I might get a call at 2 a.m. You don't need to worry about, oh, I might need to call them at 2 a.m. because the person that you're messaging is already awake. They are there to answer your questions. So it works well on both sides. You don't need to worry about, oh, should I contact them or not? If you think it's an emergency, you should contact them. There's no reason to wait. You do not need our permission to use this service. We pay for a certain number of chats per month. And if we feel like we need that number to increase because of demand and utilization, then we will. So I don't ever want it to be a situation where you're not sure if it's an emergency and you don't reach out and then it turns out it was. So we're hoping this will not put any limitations on how you feel in terms of being a foster and how you feel emergency situations on after hours might be handled. But I know this is a pretty new program. We have not yet rolled it out for all of our dog fosters. So this, again, to repeat, Monday through Friday from 7 a.m. to 5 p.m. Oh, somebody might have their microphone on. Susie, I think it might be you. I think your mic's on.
Okay, should I turn it off?
Yeah, if you could, we can just do background noise.
Hang on, let me find it. Hang on.
Perfect.
Hey,
Thanks.
Dr. Marta.
Yeah.
Just a thought. Sorry, I was listening. You can always drop in the foster chat too. It doesn't mean somebody's gonna see it or not see it, but what you would get that's better from this is me playing doctor on AI versus somebody that actually probably knows more than what I'm talking about too. I can hang with a good conversation, but you don't want me. And I will always say go to the ER. And that's not always right too, which is why our medical expenses are so high sometimes, because that's my go-to move. So yeah, there's so many reasons why behind this, but mostly because you can talk to a vet who cares which vet it is. They're following what our vets are saying. And you have peace of mind that there's someone out there. For example, I had a dog that one of my dogs ate rat poisoning at one time. So I could call this number and say, here's what it is. They always ask for the label. Should I go in? And then, that's better than, me playing Google and making myself a mess. So there's a lot of ways that I think this benefits beyond just protecting quality of life, which is so incredibly important. But it's instant access to somebody that knows what they're talking about too. So sorry, just wanted to add that in.
Yeah, no, that's great. Thanks, Jen. Is anyone on the call who has already used this program? If so, we would love to hear from you about your experience.
I know that a couple of my cat people have used it, and they said they really liked it. They liked how quickly it was. They also realized that they weren't ready to use it. So if it was a true emergency situation, they realized that they should have already created their login, their profile. So that would be one thing that I would encourage everybody to do, is get that created so that if you do need to use them, you're not spending time trying to set yourself up before you can start the chat. But the few people that have used it on the cat side have said that it's really helped them and it's been beneficial.
Awesome. Thanks. Does anybody have any questions about this program, how it will work? You might think of a scenario that I have not addressed yet or thought of yet. I would love to hear from anybody in terms of questions, concerns, anything like that about VITA.
Do you have to set it up for each foster you have? Because you said you had to give the pet's name. So if you change fosters, you have to redo it?
It will be per pet. And the reason being is that we as the staff medical team can then go into the history and look up, how many times have there been questions about this one pet? Is this happening a lot? If we change names, then that basically changes the entire medical record, and we can put this into the medical record if it's patient specific. So you wouldn't need to make a new profile for yourself as a foster, but you would want to just add in the basic information for any new foster animals so that it is linked to the medical record appropriately.
Can you put how to sign up in this group or the foster group?
Yes, we will disseminate it in all possible locations.
Just dropped it in the dog foster group. It's in the cat foster group. So what you had sent me before is the dog side.
Thank you.
Perfect. What else? Any other questions about VITA? I do, like Teresa said, I do encourage you to set up a profile, even if you don't have an animal in foster right now. I think you are able to set up a profile for yourself so that it's super easy when you do need the service and you can just quickly add the pet and then start chatting. But it's always more stressful when you have some technological thing to crawl through before you get to the answers that you're looking for.
And is this only for, is this only for Always and Forever fosters? Like, say we had a foster that had a personal emergency, but they were signed up with VITA. Could they ask a question about their own pet, or how does that work?
That's a good question, Reagan. I don't think that Jen and I have really talked through that aspect.
Well, I mean, you wouldn't be sending, we would not cover your own personal pet to go to Blue Pearl. If this was an emergency and you couldn't afford to go to Blue Pearl, I would say contact me first. That's tricky because I don't know how.
Are we okay with them using some of our allotments if they need it for a personal animal, or do we need to have that go through a different route?
You would want to let me know first. We'd have to see where we are on that. That's because we don't typically cover personal pets in general yet. Someday we'll be free for everybody. We'll figure that out, but we're not quite there yet. So yeah, I would say please just stick to your foster animals until we know how many calls we're getting. That's kind of one thing. What we're trying to get away from, and Dr. Marta already said this, is the 2 a.m., the 3 a.m., the constant worry that we're going to miss something and an animal's going to suffer. That is what it is. From personal experience, I've shared this story many times. Panda, a little dog that had parvo in Wichita, the message came through at 10 o'clock at night. I fell asleep. I didn't respond, and they put her to sleep because nobody said we could take, because I missed that message. We don't ever want someone to think that a message is out there for help in whatever capacity is, and somebody missed it and didn't respond. Now, whether that's a vet tech, or a foster, or an adoption team coordinator, this is something that's 24/7 that is available to you guys when our staff is not. So yeah, let's stick to fosters for now. And if there is a need for have your own pets, that's a one-off personal request. Come to me and we'll figure that out. Sound good? Because we always
give us something to
make
think
exceptions.
About.
Yeah, we love to make exceptions here. So.
Good question, though. Anything else about VITA before we move on to our exciting volunteer opportunities, or any other general questions or concerns that you're sitting on and can't wait to ask?
Hey, do you want to talk about how, you guys have only been going for like a month now, right? With the RV, I think. So one thing that a lot of our fosters don't know are some of the challenges that you've had. Maybe you can share some of the hiccups, because it's easy to kind of sit and be like, what the heck? We have 2 vets, we have vet techs, we've got this whole team. Why are you guys so slow? So can we just address the elephant in the room?
Absolutely.
Because the $500,000 mobile vet RV, you guys, is not perfect. The generator broke on day 2. There was a hiccup of a pole in the way, and now it's getting wrapped. But you should know these things as fosters too, because for us, we know it on the daily, like the ordering, the scheduling of getting materials here. The organization of figuring out a tiny little space with 5 people on it, the walking up to the barn to just use the bathroom, to find supplies, to use the meet and greet room. there is so much logistical chaos of organization that goes on behind the scenes that you don't see. And also the reason why, hey, sure, they could bust out 30 spay and neuters in one day if everything was clockwork. If you had like 4 vet techs, every foster was dropped off at the same time. But when you're in a new system, a new process, a new RV that sometimes likes to break, and we don't know how to fix it, that Jessica ran out and bought an RV check thing. Like there's hiccups along the way. So I just think they're sharing that and what you've gone through and grown through and where you'll get to be might help clear up, hey, why is it taking so long? Because it's easy to kind of be like, get on it, guys. But that's not the case.
Well, and no recovery space.
No recovery. Yeah.
That's the big kicker right there.
Yeah. So I'll imagine the complexity of having a brick and mortar vet clinic. If any of you have been to a brick and mortar vet clinic, you know how chaotic it is when you take your own pet. The chaos of a brick and mortar clinic is nothing compared to the chaos of working with an RV, a mobile clinic. It's so different. In a brick and mortar clinic, you've got everything there. You have the x-ray down the hall, you have a recovery space, you have a bathroom right there. All of your inventory is in the closet right where you were working. That is not the case with the RV. So as Jen said, we are spread out all over the place. Space-wise, we have probably fit 6 people in the RV at once, but if you have that many people, you cannot move around. So we are limited in terms of how many people we can actually fit in that space to do surgery. We have 1 surgical table. Yes, we have 2 doctors. I'm doing a lot of behind the scenes administrative work. If we had 2 surgical tables, we could do surgery at double time, but we also need more staff. And where will the staff go if we're in this RV? So we're limited in terms of how many procedures we can do, in part because how many people literally fit on the mobile clinic, and also in terms of where do we put all these animals. The mobile clinic came with 4 small kennels. We do not have space for a 60 plus pound dog. So we need to make sure that when we schedule that dog's surgery, that they're getting surgery at a location where we can put them to recover after surgery. So there are a lot of logistical things that you have to keep in mind in terms of why aren't we cranking these out at full speed. And many of you probably remember that we said, oh, we're getting the RV in April. I'm pretty sure it was April 15th, something like that. And then we said, okay, well, we'll be ready to do animals mid-May. And the big question was, what? Why? Well, there are a lot of regulatory things that had to be put in place. The state of Kansas does not allow a veterinary clinic to be owned by a 501c3. So we had to do some changes. That's why we are now a legally separate entity, St. Francis Outreach. We also needed to make sure that we were legally able to practice medicine in that space. Just because Dr. Stafford and I have our vet licenses does not mean that we can perform surgery in that mobile clinic. That mobile clinic also has to be licensed, and we depend on timing of the state to be able to do that. We also depend on timing of the state to be able to use the x-ray machines that we have. Just because you have them doesn't mean you can use them. You have to be certified to use them. So there are a whole bunch of things that led to the delays and the delays and the delays. A lot of it was way out of our control. So just know that if you are setting up a mobile clinic on your own, talk to somebody who has done it. I'm working on a manifesto, so you guys can do this in the future. But it is incredibly complex, and we so appreciate all of the patience that you've had for us. I know that, we just kept changing surgical dates and moving things farther and farther down the road, and it was certainly not to annoy anybody. We were always horrified when we had to change the date on you guys. But that is a little bit of the background of what has gone into making this a mostly successful clinic. We have hiccups every once in a while. It's just part of learning. But it took a little bit. We're getting there. We're still figuring stuff out. So if we say we're doing something one way, and then 3 months down the road we say, actually, we found a better way to do that, please don't be surprised. We don't want to change things willy-nilly, but with the expansion of this program, once we add the KCMO location, brick and mortar hospital, things will continue to change. They won't change forever, I promise that. But in the first year of anything starting up, especially something this complex, it's not uncommon to have minor and major shifts in protocols, the way we do things, because we're trying it out. And then if it doesn't work, we will have the flexibility to change that. But we don't always know what will not work until we realize that it has failed. So that is part of the process.
Hey, to Julie's point, we are getting the concrete poured for our little hospital at Osawatomie today, which is great. The mini barn's ordered, it's ready. It will be delivered there. So then you will have recovery. Another thing that you left off is we can't even plug the RV in at Spring Hill. So then if the generator doesn't work, they don't have air conditioning. It's 100 degrees outside. And so you will be able to we're also going to have a little mini barn in Spring Hill that animals will not live there overnight because we're not zoned to do that, but it will be a little recovery hospital for the day. So all these hiccups along the way that we're discovering what we need to put in place, it takes time to find solutions for them. And that's not something that we try to share as much as possible, but it's very, very hard to share across large groups and disseminate that information so that everybody understands it. And also why we're going to do these lunch and learns. So once a month, all of our fosters will be invited to a lunch and learn. It won't always be the med team. It will be training. It will be intake. It will be, whatever we want, because we're all in this together. And I'm going to challenge you on that. Everything always changes with Always and Forever. And for the most part, it's for the better. But we are constantly striving to grow and change together. But yeah, you nailed it. Very helpful. Thanks, Marta.
Absolutely. Any other questions before I let Reagan explain what our volunteer positions are? Even if you personally are not in a position to be able to volunteer, if you know somebody who's interested in any of the positions that she has to talk about, we would love to have you give them the information. The easiest way right now is the ANF info email. Those are being forwarded to us. But we will soon set up our own email so you can respond directly to any interest in the volunteer positions that way. But any other questions about processes, VITA, any concerns about changes you've noticed with having in-house medical team? All right, Reagan, would you please explain to us what we could use help with?
Yeah, so we have started some volunteer positions. We have 2 pretty much figured out now, and we're adding a 3rd. The first would be recovery, and that's probably the most intense position just because it's a very important job. Basically, recovery is after surgery, the patients are going to be monitored with their heart rate, respiratory rate, and temperature, making sure they're waking up okay, staying warm, then alerting the medical team if something's not going to plan. And then the next position would be PACs. And so that's super important for us. Another fun dynamic about being RV is that we're not able to wrap our PACs right now on the RV. It requires an autoclave that is so heavy and an ultrasonic cleaner and counter space, which we don't have. So Melissa Second Chances has been really kind.
Yeah. I'm going to interrupt you. What's a PAC?
Gotcha. A PAC is basically a term for a pouch of instruments that we use for surgery. And so basically it's compiled of different specific instruments that they'll need for the different surgeries that we're doing that day. So for example, we have packs called large dog spay packs, small dog spay packs, dog neuter packs, cat spay packs. Those are just some examples. In those different packs compile different instruments for them to be able to do that surgery. And so just based on how many surgeries we do that day is going to depend on how many instruments we have to clean, and then we have to rewrap all of those packs, sterilize them, and get them back on the RV for surgery. So that's quite a long process. So we could use help in several ways in that way. Mostly being wrapping and cleaning the instruments, but also cutting drapes that go into each pack for the surgeries as well. And so that would be a not pet facing position. So if you don't necessarily want to work one-on-one with animals, or you want more of like it's kind of feels like my craft time where I get to use scissors and cut drapes and be on my own. It's kind of nice. So if that seems like something up your alley, we can still definitely use help with packs. The third one that we're still figuring out, so hopefully we'll get that rolled out soon, would be data entry. And that is similar in that it's not animal facing job. You would be probably remote. A lot of the training would be one-on-one, either on the computer or meeting up in person. But basically, we would just show you how to input all of the information that we needed for surgery. So drug amounts, what size trach tube we use for the patients for surgeries, different things like that. So yeah, that one we are still working out, but we are definitely ready for PAC position and for the recovery position. If you know of anyone interested, you can send them to that ANF info email and they'll forward that to us.
Reagan, if they have questions for you directly, is there a way that you would like them to contact you about these positions for anyone who's on the call?
My email, which I can throw in this chat once we're done, was a great way to contact me. I think it's just rtrevino at Always and Forever, but I'll write that out in case you don't know how to spell my last name.
Perfect. And one thing to also mention about all the volunteer opportunities, we are all over the place. You guys already know this about Always and Forever. We have Wichita locations, we have Spring Hill, we have Osawatomie. We're about to open or at the end of the year, open the KCMO location. So you don't necessarily have to be close to all of them. You can, if you want to do something in person, but you're really far from one location and one other location works better for you, please just let us know. Generally, we can accommodate. And like Reagan said, some of the stuff we could use help from anybody. You could live in Europe and you could help us with this. So we are not limited to only in-person volunteer opportunities. So I just wanted to reiterate that because it will be very helpful for us. Paperwork takes forever.
Are you guys looking for a time commitment? Too? Did you mention that?
Reagan answer that.
I did not. Yeah. So we are mostly just because of how intense the training can be and it takes a lot of our time. We're looking for a 6-month commitment. And then we ask that you'd be there at least once a week. That could be more than once a week, but at least one day a week for 6 months if you'd like to sign up at this point, just because it requires so much training and work on our end. We want to make sure it's a useful, whatever am I trying to say?
For you.
A good use of our time. A good use of our time.
Yeah.
We also
So if you did recovery, are we looking at a 5-hour shift, 7-hour shift, 8-hour shift?
Recovery, we've been having volunteers come around 9, and then I would say you can expect to be done by noon. Kind of depends on the day, but I would plan for 2 hours.
That's not a big commitment, yeah.
No, just a couple hours.
The only reason I need to know is because I usually have a lot of dogs at home. are very aware of my absence, and they do form a mutiny while I'm gone.
Yeah.
Well, working in recovery would give them a lot of good smells.
Yeah, right.
Reagan, would you say that the time commitment for all 3 volunteer positions would be similar, or are you anticipating some would take less time or more time?
It's a little more flexible on the pack wrapping right now, just because we're not in a rhythm of when our dirty instruments are there. So right now, I would say most positions are at least an hour and a half to 2 hours. Data entry is probably less, depending on what we would just send you. The training would take a couple hours, I'm sure. But for packs right now, we're doing a lot of cutting of patient drapes. So once you feel trained or comfortable on that, and assuming that Melissa's is okay with a volunteer being there on their own, then they should be able to just go in and cut those drapes for a couple hours until those boxes are full, or whenever you get tired, and then stop.
Awesome. And
Do you
I don't
guys
think
have-
this is the end of our volunteer positions. We're going to continue to create more.
Oh yeah.
Do you guys have an age restriction? We do have high school students that are like interested in vet tech programs. They come out and help with the minis sometimes. Is there somebody could volunteer with their mom if they're 16? Have you thought of that?
Reagan does not know this, but I have thought of this. If they're coming on their own, we ask that they be, mid 20s out of college, just because there are a lot of moving parts. It's not to say that a 16-year-old could not be successful in this role, but we do want, if they're coming on their own, to be minimum of 25. Teenagers, we are always open to having people shadow us. It will be much easier to do when we have a brick and mortar location. So shadowing right now is just not possible because of the space. So if we do have any younger people who are really interested in helping in some way, or they want to learn more about what this side of veterinary medicine looks like, feel free to send them our way, and then we can let them know how we might be able to accommodate them. We certainly could have people come with their parents, probably more non-animal facing roles for underage kids, but we will have opportunities for everybody, and those opportunities will continue to expand as the KCMO location opens. Well, thank you, Reagan. Does anybody have any questions about volunteering? If you now thought of another question about VITA or the medical team in general, we would love to answer anything that's on your mind. All right. I don't think so. Jen, do you have any questions?
I don't. This was a great kickoff. We did kind of the meet and greet pizza in the pasture a few months ago, but kind of like what she said, everything changes. So this is the first of many. It will probably be, I would say, expectation wise, you'll probably hear from our med team quarterly with these kind of lunch and learns. You can come to them with any questions, any concerns. You guys' feedback is so valuable, even when it's hard to hear, because what can we do? That's something we can learn from, grow from, and change. So if you hold it in, if you're like, you guys are failing, if you get flustered and frustrated, nothing will ever change. We'll never be able to help you. And we are all human beings doing the very best we can in the circumstances we're in, creating a brand new program. We don't even have a model we can steal with these programs that we're trying to put in place, with helping the community, with helping other rescues, with helping our staff, with helping our volunteers too. So it's an incredible journey to be a part of. We so appreciate your patience, your grace, your forgiveness, and your willingness to hang with us in creating something really, really, truly spectacular and to be proud of. And it doesn't happen without our fosters. That's it. It doesn't. So reach out anytime in any way, except from the hours of 5:30 p.m. to 7 a.m. If it's a medical emergency, go through VITA. I'm always around too. So and use I love that we use our foster chat teams to lean on each other. Don't lean on each other for medical advice. Message VITA, go that route. But it's a pretty cool support system. And very, very appreciative of all of you. But thanks for kicking off this first. Nobody ate lunch. It's hard to do a lunch and learn. You can bring your own brown bag next time on this. But that was it. Short and sweet. It's perfect. So
thank you all for being here. It's so nice to see more of you and hope to get to meet more of you in person.
Hold on. Jessica, did you record this? Did you hit record? Somebody hit record.
It is being recorded. Yes, I have a recording.
Where does it go then?
I have no idea. We'll find that later.
I recorded a cat program and it went nowhere. So
it should be,
okay.
I believe it'll be in your, I think it's going to be in your chat, but they will, if you don't save it down, they will expire after a very short period of time.
Good to know.
Let's have Joe will put this on YouTube. I feel like let's punt to Joe.
Email.
Okay.
Dr. Marta, if you have questions, holler at me, because I recorded our last team meeting and I figured it out mostly.
Beautiful.
Mostly. Did you hear that disclaimer?
Okay.
Mostly.
Hey, Reagan,
It's always for everything.
Yeah.
Share your email.
Oh,
Don't
yes,
forget.
Reagan.
I
Don't
will.
forget.
I will.
Okay. Good.
Reagan's got her, Jessica put her email in there. It sounds like Jen is sending out the VITA to everybody.
Yes, it is in the dog and cat foster Facebook message groups. So those were the instructions that you had given me a while ago.
Perfect. Okay,
Yeah,
guys.
just so you know, when you have to end the call by pushing the red phone. You can't just X out.
Okay. I will end it and then hopefully the recording will stay. All right, guys.
Bye, guys. Thank you.
Thank you.
Thank
Bye.
you. Bye.